Tonight on News 5 Live, Belize remains in yellow phase. No new cases of COVID-19. A new shipment of test kits and other medical supplies are on the way. BEL will apply a 2-month credit to 7,000 customers and suspend disconnections in tourism industry. Another team of Cuban doctors arrive. 2 women are charged for harboring suspected gang members. And we'll take you behind the scene of locally made sanitizers. Details of these stories and much more coming up in tonight's newscast. Good evening. Welcome to News 5 Live for Friday, March 27th. I am Sabrina Daly. Tonight, the country remains on the yellow phase, which is phase 1 of COVID-19. There are still only 2 confirmed cases of the virus in Belize, and both are in San Pedro and involves a 38-year-old woman and her mother. The Ministry of Health says that the tests done between Thursday and today are all negative. To date, almost 90 tests have been done. During today's Ask the Experts live webcast, Ministry of Health officials gave an update into the COVID-19 response. Director of the Epidemiology Unit, Dr. Russell Manzanero, shares the latest into the testing being carried out by the Central Medical Lab.
To date, and currently in real time, we're actually processing an additional samples for COVID. To date, we have actually screened 86 samples for COVID, of which we know that it's the same 2 that have remained positive, the index case and her immediate contact. We do know that areas of being screened right now, we have 3 samples that were screened from Belize City, 3 from Corozal, and 1 from the Stan Creek district. So 4 of those are already negative that we're seeing, and the other 3 are actually being run right now. So that's what we're waiting on. So that's just to give you an update of what all we've been doing. Of course, there is ongoing testing for additional influenza viruses. That's ongoing as well. But particularly for this case, for SARS-CoV, COVID-19, this is the amount we have tested so far, 86. And the 4 for today remain negative.
So, as you heard just now, there are no new confirmed cases of COVID-19. The index patient and her mom remain in isolation on San Pedro. As you know, those 2 cases resulted in the state of emergency on the island. At this time, the ministry says the 2 patients are not exhibiting serious symptoms and are being monitored. Health officials also continue to their tracing on the island. Dr. Marvin and Russell Manzanero tells us more.
I know that people had asked what happens in terms of the clinical situation with the patients. I am told that the index case, the first female, is actually had a fever this morning, doesn't have any other flu symptom. And the mom, and I can read textually what I got from the person who does FaceTime with her, because we are monitoring her other chronic conditions. It says no signs of symptoms, no fever, slight stuffiness in the right nostril. I'm reading it textually, that's how I got it. And she indicated to the person who was doing FaceTime with her that she had slept like a baby. So that's pretty good news in that regard, because at the end of the day, what you want to minimize is mortality. Also, people had asked how long before they are declared COVID negative, because you see how the mapping is done in terms of when people are positive, when they are negative. You would have, that's 14 days after we do the initial swab, and you would have to have 2 negative samples consecutive before you are declared a negative case in that regard.
I guess from the initial mapping that was carried out, when we did for the first, the index case, we did get back about 8 to 12 individuals who had direct contact with them. That is inclusive of the family members as well. Of course, with that first mapping, we were able to detect the immediate contact in this case. For that person, we do have it's an individual who's over 65, so it's somebody who's there. But we do know that she is right now very stable, even though she may have some underlying comorbidity or underlying illness. She is very stable. In regards to contacts from this individual, we really are still looking at that, and I know that the personnel out there on the island, they're still doing their contact tracing as well.
Another issue covered today by the health experts was the matter of testing kits and other medical supplies that were known to be in limited quantity. Director of Health Services Dr. Marvin Manzanero says a shipment of test kits and personal protective equipment is on the way to Belize. He outlined the schedule of arrival, as well as the cost and items coming into the country for health workers to respond to COVID-19.
We have 5,000 individual test kits slated to come in. Those are already paid for. 7,300 PPEs, those are already paid for, and they're on their way. The 6 initial ventilators are slated to arrive today. We have just signed on to a document to procure test tubes, which are materials used for the actual swabbing and blood samples that are needed to be taken for the study we are undertaking. That is, I will give you a total monetary value so that you can also appreciate the cost this has. I know people are saying about the initial budget given of $900,000. I think we have gone beyond that, maybe from last week, if not before. But we just paid $93,000, or going in the process of paying $93,750 for test tubes. From one source, we are paying $36,500, and for another source, $212,600. This is for a total of 20 more ventilators. 6 X-ray machines are scheduled to arrive, portable ones, next week, and I know we are getting 2 portable ultrasounds also for use in that regard.
Earlier this week, the Belize Electricity Limited said it was making a contribution of $1 million to assist in combating the spread of COVID-19. Now the clamor on the ground has been for BEL to waive electricity charges in the months ahead in light of the economic downturn and the joblessness faced by many households. The sole provider maintained that it buys power, and because of the operating expenses, it does not have the cushion to provide electricity free of cost. Today, BEL softened its position to say that it will apply a credit to the accounts of over 7,000 customers in the social classification of the February and March electricity bills. This credit will apply even if a customer has already paid their monthly bills. Customers classified in the social bracket are those who consume an average of 60 kilowatt-hour or less monthly, solely for domestic use. The utility company is also suspending disconnections through April for those customers in the social and residential classifications countrywide, and for all hotel and restaurant customers, as well as for tour operators. This measure will be revisited thereafter. BEL is also reaching out to customers who may have difficulty paying their electricity bills and are asked to contact their customer care representatives. The Cuban government has been deploying teams of doctors and nurses to fight the COVID-19 pandemic across the globe. With considerable experience in combating deadly diseases, the Cuban health personnel are in demand, even in wealthy countries. This afternoon, a second brigade of health personnel arrived at the Philip Gosselin International Airport and will join 32 others who arrived in Belize on March 25th. The medical brigade will now go into 14 days of quarantine, as mandated by the Ministry of Health. They will, along with the Belizean frontline health workers, provide much-needed support to persons who get infected with COVID-19. Welcoming the contingent today was Cuban ambassador to Belize, Lizette Perez, who says that the support from the Cuban government is part of her country's tradition in the region and across the world.
Today arrived to Belize the second group of Cuban medical personnel, part of the Henry Reef contingent, who is traveling to different countries of the region to help in the matter of face the COVID-19. This is a tradition of cooperation of Cuba with the region, but have a lot of precedents regarding facing other pandemic in the global arena, like for example Ebola in Africa or earthquakes in Asia, or for example cholera in Haiti and other countries. It's part of our precedent history in terms of cooperation, and we are very, very proud of that Cuba always is with the third world country, with our neighborhood to help in terms of health sector, in terms of education. But today is special because we are receiving this contingent to face a pandemic, a challenge that we are facing, all of us, all of our countries, and that we have to be well prepared. That's why this contingent, almost 60 persons, is here in Belize as a request of the government of Belize to help and work together with the Belizean health personnel to face the pandemic or the challenge that the pandemic could give us.
Ministry of Health Pablo Marin told News 5 that today's group will be assigned to the isolation area and intensive care unit at the Carl Huchner Memorial Hospital. Minister Marin says that today is a great day because of the almost 90 tests done in the country. Only 2 have been positive up to now. He says that the Belizean people need to adhere to the guidelines of the ministry in order to fight this virus.
Asking the general public to keep calm, but continue to follow what the Ministry of Health is saying, to wash your hands, keep your distance, don't touch your face, and we can come over this with all the help that we are receiving right now. I think this is time that all Belizeans should come together and work as one. As you can all see that we have the Prime Minister and the Leader of the Opposition working together in unity because of Belize, and that I think it's showing solidarity. And just like the Cubans came here to help us with this virus, so is the rest of the country, and a lot of them are coming up by giving donations, helping with different things in the Ministry of Health, with the people around, and that is what we want, for everyone to come together for us to fight this virus.
If you've been checking at stores and pharmacies, you would be out of luck for hand sanitizers. The item has sold out just about everywhere as consumers prepare for COVID-19. But the folks at Travelers Liquors have come to the rescue since they already had in stock the main ingredient, high-proof alcohol. Relying on a formula from the World Health Organization, the company is now producing Sanibel hand sanitizers. Here is Hipólito Novello with a report.
Hand sanitizer is one of the most effective weapons being used to battle the deadly COVID-19 virus. Since the spread of the disease across the world, there has been a shortage of this product. As the virus got closer to Belize, this item sold quicker, and when the first COVID-19 case was confirmed and announced, Pearl hand sanitizer are virtually non-existent in stores and supermarkets. There is a demand for this product, and Travelers Liquors Limited recognizes this demand. The company has begun producing Sanibel hand sanitizer.
When the pandemic was getting worse abroad, we decided to try to do it because we couldn't buy hand sanitizer ourselves, so we realized that we were short. Belize was short on the product.
The company established communication with government officials, colleagues at the West Indies Rum and Spirit Association, and with a formula provided by the World Health Organization, the production of Sanibel hand sanitizer got off.
We got a formula from WHO, and this is the formula we used with our alcohol at 95% alcohol. And then when we put in all the additives, it comes down to 70%, a little over 70%, and that's a sanitizer.
The base of it is the alcohol at 95% proof. And you add the hydrogen peroxide, the glycerin, and the citrus oil. The
orange oil comes from CBBL. So this is like 95% of what is in this product is completely Belizean.
You start with the alcohol, then you add the hydrogen peroxide, the glycerin, the citrus oil, and water. And this will sit for 72 hours before you can use it.
And before you use it, you're advised to read the label. It's for external use only and not for consumption.
So I don't want anybody to think that it's for consumption. It's not for consumption.
Well, if you look at the label specifically says not to be consumed.
We have that's what we had to put on the label. We couldn't just use an old label. We had to put all the warnings. And we want to make it clear to keep away from children, to keep it away from the fires. It's flammable. Don't put it on your hands and go like the stove because you might get burned. We really need it's for sanitizing and disinfecting.
Since the rise and spread of COVID-19, travelers' sales have plummeted. The company's new product ensures a sense of stability during this crisis.
We just did a batch, and we got close to 50 cases each of each size. So we have the small size, maybe the personal size, then we got the liter size, and then we have the half-gallon size. So the first batch gave us about 50 cases each, and the phones have been ringing off the hook, and most of them are gone.
What about distribution?
Distribution, everybody's coming here picking it up. We have not had to deliver to anybody yet. They're all coming to get it here.
Reporting for News 5, Hipólito Novello.
Coming up, the PM and the leader of the opposition call for calm in the face of the deadly COVID-19. There are 2 cases of COVID-19 in Belize, but the deadly virus is already having a toll on the way of life. It is an enemy that attacks everyone, from rich to poor, from reds to blues, across the landscape. The people are all vulnerable to the contagious virus for which there is no cure. On Thursday evening, the Prime Minister gave a sober message to the nation, calling for calm, giving assurances that there is food security and that Belize is positioning itself to face the uncertainties of the months ahead. Here's News 5's Hippolyta Novello.
Before the COVID-19 pandemic, downtown Belize City will be bustling. Cars will be bumper to bumper on Albert Street and shoppers will be in and out of stores. But this was the scene this morning. The streets were less congested and only a handful of people were out. What's happening in downtown Belize City is what's happening to the country on a much larger scale. Huge chunks of the economy are shut down to slow the spread of the virus. Thousands have become jobless and small and medium businesses face permanent closure. But the leader of the nation, Prime Minister Dean Barrow, says stay calm, don't panic.
In the end, though, as Prime Minister, I am the one who has to accept the ultimate responsibility for custody of the nation's well-being. Especially in this time of an existential crisis of seemingly Old Testament proportions, I must personally come before you. Hence the reason for this address. My primary message is to assure you that you are not alone, neither in your anxiety about the present challenges nor your preoccupation about the future. I thus reiterate to every Belizean that my administration, together with the national committees, will spare no effort, will action every partnership, will lose no opportunity to cushion the economic impacts and minimize the medical repercussions of this pandemic.
There are over 500,000 confirmed cases of COVID-19 in the world, with the USA now having the highest number of coronavirus cases. Belize has 2 confirmed cases, but if trading partners do not get a handle on this virus, Belize's economy will suffer for many months.
You know that neither the depth nor the duration of this battle is yet clear. In this connection, Belize and all countries, from the richest to the poorest, are in the same boat. We face a lethal, deadly enemy that refuses to stay still long enough for us to get a bead on it.
But Prime Minister Dean Barrow says that Belize is properly positioning itself for this battle.
We do so both on the economic and the medical fronts. First and most important, we can feed ourselves. And there are 2 things that are important in this connection. The global supply chain that facilitates imports of essential inputs for our country is not being broken. Even more important, though, is the fact of Belize's self-sufficiency in all basic commodities. With our local production of grains, meats, vegetables, and poultry products, we are able to dig in for the long haul. That is what sets us apart.
PM Barrow says that government is prepared to fortify the economy through a wide range of fiscal measures. The country's healthcare professionals are being supported by a Cuban medical brigade. But to contain the spread, the public plays a crucial role.
As hard as the circumstances are, there is no need to panic. And even if we have to take the ultimate step of a national shutdown, there will be no interruption of essential services. Access to food, pharmaceuticals, and other necessary supplies will be guaranteed. In short, government and its partners will move heaven and earth to protect our Belizean people. Of course, we need your help. We need the cooperation and understanding of each and every Belizean. This crisis, like no other, demands a unity of effort, a spirit of collaboration, an overflow of fellow feeling, and a pouring forth of
all the reserves of national humanitarianism and patriotic solidarity.
Reporting for News 5, Hipólito Novello.
Opposition leader John Briceño co-chairs the COVID-19 task force. Briceño today released a pre-recorded video message addressing the challenging times that Belize and the population will be plunged into. As the health system in first world nations collapse due to COVID-19, Belize is standing firm. The nation's experts are working around the clock to contain the spread of the virus, and safety measures have been put in place to prevent an outbreak. Briceño says that the best practice right now is social distancing.
Because to date there is no vaccine or pill, no known cure, drastic measures had to be taken. These measures were necessary and based on advice from our experts. For now, what we know is that the best defense we have is if we all practice social distancing and we all practice good personal hygiene. Yes, some of the measures announced by the government are hard. They not only force us to stay at home and to keep away from people we love, they are keeping our children out of school, and it is limiting our ability to go to the market, to go to church, to visit a sick relative, and even to comfort our friends in times of grief. It is not easy, but as I said before, we must do all these things to protect each other. It's ironic, isn't it? In essence, we are doing all this out of love. Now I know these are tough measures, not only on families, but also on businesses. Many businesses, especially small businesses, are not earning any income. Some business owners have been forced to lay off workers, and they now join the thousands in the tourism and services sector who are trying to figure out how they will meet their expenses. The farmers who toil the rich Belizean soil are also seriously affected by this dark economic reality.
According to Briceño, the task is daunting and the days ahead will not be easy. If the economy is to bounce back in the shortest possible time, the entire country has to work together.
We're working with the banks to see how we can postpone loan payments, lower interest rates, and implement other creative measures to help to ease the financial pain on employers, but more importantly, on employees. Let me assure you that as long as I remain a part of this team, I will do everything possible to ensure that everyone who needs assistance for food will get that assistance. But for this to happen, we will all need to be unselfish and care about each other. Belizeans, the days ahead will not be easy, but I remain optimistic because I know that it is always in difficult times that the resolve of the indomitable Belizean spirit comes to the fore. Working together, we can save lives and put our economy back on track in the shortest possible time.
The women who were charged on Thursday for harboring a person wanted by the law for a gang-related offense have now joined that person behind bars after Justice Francis Cumberbatch denied them bail. Kendra Foreman and Christine Carcamo were nabbed on Tuesday at a house in the Balama Phase 4 area of Belize City in the company of Ainsworth Keyshawn Foreman. Foreman was wanted as a part of the city's state of emergency from last week by police and as a part of the sweep of persons believed to be connected to street gangs responsible for the recent spate of gun violence in the old capital. The case was adjourned until May 28th. A man who just got off a murder charge earlier this month and is facing attempted murder and other charges was this morning told to apply for bail before the judge who was presiding over his case for attempted murder. Supreme Court Justice Francis Cumberbatch advised Carl Renaud to seek bail from Justice Marlon Williams, who was presiding over his case for the stabbing of Robert Hauer. Hauer was stabbed while he was walking on Antelope Street on the night of March 9, 2013. Just 3 weeks ago, on March 2nd, Renaud, who was on trial for the 2017 murder of Jahim Mahler, was acquitted after defense attorney Baha Shoman made a no-case submission before Justice Colin Williams in a trial without a jury. Shoman's submission was based on discrepancies in the testimony of the main witness and the fact that no one who could positively identify Renault as the shooter. The other offenses which Renault is now facing were allegedly committed before he was arrested and remanded for Mahler's murder. Delson Carrillo today sought and was granted freedom while he waits for his case to be called to trial. He is charged with having unlawful sexual intercourse, which means that he had sexual relations with a minor. Carrillo also appeared before Justice Francis Camberbatch and was granted bail of $5,000 plus one surety of the same amount on the conditions that he does not interfere with the complainant and that he returns to the magistrate's court on his next scheduled proceeding. The incident for which Carrillo is charged allegedly happened on March 18th in the Orange Walk district. But a man who allegedly broke into the law office of former Belize City Mayor Darrell Bradley and stole artwork and miscellaneous items worth over $2,000 was denied bail. Jason Hernandez, a resident of Albert Street, is accused of removing the wood carving, a fan, and other office fixtures from the law firm of Bradley, Ellis and Company on Regent Street, which is right in his neighborhood. The incident occurred on Wednesday of this week. Magistrate Tricia Pitts Anderson adjourned the case until May 27th. 41-year-old Kenrick Renault was shot in the foot this morning. The resident of Consuelo Street was shot by police when he attempted to flee the scene of an attempted burglary. Renault reportedly tried to break into Quinn's shop on Mahogany Street in Belize City this morning sometime around 3. The owners of the business were woken up by sounds of the intruder breaking into their store. When the businessman went to make checks, he realized someone was inside his storeroom and he called the cops. Police responded to the scene quickly and Renault was apprehended in the area. Reports are that Renault attempted to assault one of the cops with a tool. The cop reportedly warned Renault, but he kept advancing on the lawman, who then fired shots, one of which hit Renault in his right foot. He was taken to the KHMH for treatment and is expected to be charged. Police also apprehended a second person in the area believed to have been involved in the attempted burglary. There is much more news coming up after the break, so stay tuned.
Save, save, save. The credit union way. Save.
Almost 90 samples from across the country have been tested for COVID-19. The samples are sent exclusively to the Central Medical Laboratory in Belize City, which is the only certified medical facility that is carrying out the COVID-19 testing. The Ministry of Health, however, is looking at other ways of testing in the near future. Today, epidemiologist Dr. Russell Manzanero said that the Ministry of Health is looking at what the region is exploring, as well as what other resources can be used to support the capabilities later down the road.
Currently, what we do have in place is that we only have the Central Medical Laboratory in Belize City that is doing the certified PCR testing for COVID-19. We have no validated rapid test in the country, so CML is the only certified laboratory to actually conduct certification for COVID testing. We do indeed are looking at other ways of testing. We do know that there is another source of potential testing in the near future. I know these are discussions being done in the regional level. We do know that the gene expert machines that we have in country are currently being used for testing for TB, for tuberculosis. So at this point, there has now been further investigations and research, and we're now able to look at a potential source of testing for COVID-19 as well. This is actually being looked at to see how we can actually, besides testing for tuberculosis, for COVID-19, of course, the turnaround time for that would be shortened by half. However, these discussions are still in the process. It is not being marketed to everyone, so it is still being in discussion globally. So we're going to see which countries would be the ones actually accessing those testing kits. Of course, we do have the machines in country, so we have the capacity to run those tests. However, we still need to engage in discussions with our regional stakeholders as well. So I guess for testing, that's another source that we can look at afterwards as well. And of course, we have reached out to our Director of Health Services to discuss that kind of testing. And of course, if we have the capacity to do it, we will be looking at that as well.
The Ask the Experts session by the Ministry of Health is a good source for COVID-19 updates. One of the issues that came up a couple times was the compensation available for frontline workers, such as nurses. The Nurses Association has sent out a release with at least 6 concerns of the profession. They say they are not aware of where isolation of nurses will be done, coverage for themselves and their families, and that there is not sufficient protective equipment. The association also warns that the preparedness plan has been rolled out too late, infrastructure is lacking, and the transportation of nurses to and from work is problematic. Here's the response from Director of Health Services to some of their concerns.
Will nurses be getting paid hazardous allowance, given a proper place to stay to rest since they won't be going home? Every region has been asked to identify areas, and I think all regions have said this is where you're going to stay. The hazardous allowance is something that I think is warranted, and not only that, I think frontline workers that are able to go and see patients should be compensated, incentive allowances and all of that. Of course, that's a process that we are going to lobby for all, and we have been lobbying for all of that, and like that kicks in once we start seeing those patients. I mean, if you ask me, for example, the doctor in San Pedro who has been doing a good job of heading a team of contact tracing, he is also one of the frontline workers who has been directly exposed, so that needs to be compensated somehow.
Dr. Marvin Manzanera also raised concerns about health workers facing discrimination, as well as being aggressed by the members of the public. He says that there are reported cases in the West and North where health workers are having problems accessing stores and public transportation. He calls on the public to refrain from these acts and reminds us that these persons are a critical part of Belize's response and preparedness for COVID-19.
Our health staff has now come to be aggressed, at least in 2 communities, and I need to say that because we are aware that in San Ignacio particularly and in Corozal, we are being told that health staff is not being allowed to go into the stores to get their groceries. We are being told that people don't want to sell them food, even though they are doing their routine work schedules. And we have even issues with transportation where taxi drivers and bus drivers are not allowing health staff to get on board, are not being picked up at all. And we really do not expect that to continue to happen, because we are expected to carry out our functions. So that's, if we can call out the community that this is not the time, I think, to be isolating health staff in that regard.
And while many of us may be tired and frustrated by the all-new measures put in place, they are necessary. Dr. Marvin Manzanero says that we may have to hold out a little longer because the situation outside of our borders is worsening for some countries. He points out that predictive models in the USA show that Belize's largest tourism market may not improve until several more months, and those projections also have a bearing on our way of life.
We are in this for a long haul, and we are not trying to cause panic to anybody, but I was looking at the modeling that the Mexicans are doing, and that's the one I follow a lot. And the US, of course, but those are the closer ones to us, to our reality. They are not thinking that they are going to come out of their curve, and we don't have a curve. Maybe the next session we're going to explain with what flattening the curve means for people to understand where we would want to go. They are not thinking that they're going to come out of any curve until the middle of November, and that's when the flu season is routinely on for them. So that they are saying, you're talking about the next 18 months of your life changing as a result of COVID-19. So this is not just the next 2 weeks. I mean, whatever measures we are taking now, that will remain for us forever.
When we come back, board games, an affordable classic form of entertainment to ease the stress.
Belize Medical Associates.
As more stringent measures are put in place to prevent the transmission of COVID-19, life as we know it is different. With the closure of schools, layoffs, and work-from-home measures instituted by employers, thousands of residents must stay at home. Our public routines have been upended by social distancing, and you may have had your fair share of time in front of the TV. So, to help ease the stresses of life without travel and public gatherings, we went to look at board games, an affordable classic form of entertainment. So if you have nothing to do at home or your kids are bored, there are many fun ways to engage them, and you can also get in some quality family time. Here's the story.
If you have children at home and are looking for ways to keep them engaged, whether through educational or fun activities, you may want to pick up some storybooks or board games for them. If you don't want to break the bank, there are low-cost, high-quality options available. Our first stop was at Golden Bay in Belize City.
We have charts for little kids, we have storybooks, we have the Ladybird brand in small fairy tales. And we also have like arts and craft items like ponies, little ponies, and we also have modeling those. Those are some educational stuff because they have like different stages, like if you want one, you can do standard one. These are more books that they can use in mathematics and different subjects.
So they don't necessarily need a teacher to guide them along the way. It's very easy to follow.
Yes, it is. It is very easy and it's not that challenging. So it's a concept that I know a lot of kids are using at the early level. So that is what some books we have. Or you can, if you want to use some simple things like coloring books or some reading time. And it's a family type game. All of them are family type. Like Monopoly, it's a very interesting game. Like I know a lot of people are familiar with that, and it's very, very interesting. And then we have some of these ones, like the headbands. This one here is like you push it on a line, different. You list your features, and then the person in front of you they ask you what you are, right? So that is what the headbands is about. And then we have some little draws, like these, we use. These draws here are, a lot of people are going to this, so like early learners can use these for chess games.
Our next search for fun and educational activities took us to Mirab Department Store, a wide selection of games if you're looking to pass time or explore a new interest. Then you can consider playing traditional or more modern board games. Again, a wide price point is available for the variety of options for children and adults.
We do have games starting at $6.95, which includes tic-tac-toe, all the way up to Monopoly, the very famous Jenga that everybody's into. Our prices are very reasonable at the moment. So we do want the families to interact with their children meanwhile they're at home, have fun with them. Even outdoor activities that you can find to do with your kids at the moment would be something great. If you have large spaces to run around, we have football starting at $14.95. So those are activities that we'd encourage everybody to do right at the moment with their kids. Carry a large selection of casino games as well. So dominoes, we have Russian roulette. We have the famous bingo that you can play as a family. That's something that everybody is asking about lately, the bingo games. Backgammon, chess, all the famous games, and we carry them in different price ranges as well. And we also carry a large selection of toys for kids from Melissa and Doug. So those are toys that a lot of people look for because of the quality that they offer. And those are new. We've started carrying them for the past, from Christmas onwards, we've started to carry these. And we just like to tell everybody that these toys, you will get the value of what you're paying for them. Speak Out perhaps is something very new. You're going to be asked a series of questions with this one, but it requires using mouthpiece. So when you have the mouthpiece in your mouth, you have to speak with the mouthpiece in. So that's something different. Twister now comes in a blindfolded twister as well. And it carries patterns, so you'd learn how to move around using the patterns.
And if you have health and safety concerns, both Golden Bay and Mirab are taking precautions to help keep you safe. You can reach out to both stores via phone or their social media pages to make inquiries and in some cases, online orders. Reporting for News 5, I'm Andrea Polanco.
If you want to get in touch with Golden Bay or Marab to find something fun to do with your family, you can get in touch with them via their Facebook pages or phone numbers. Protocols have been installed at children's homes across the country as the Ministry of Human Development prepares home managements for COVID-19. On average, COVID-19 is milder on children than it is on the older population. Still, to cut exposure, visits to the homes are no longer being permitted, and a lockdown has also been put in place as a preventative strategy. Today, News 5 visited with the Liberty Foundation in Ladyville, where the preschool and daycare services has been suspended until further notice, while other measures such as social distancing and hand-washing exercises have been put in place.
We have a preschool and a daycare. Well, the ministry had put out a release to close the preschool. Ministry of Human Development also gave us directive to close the daycare. For us at the home, all the residents are contained. We have several types of accommodations where we have the more communal type, and we also have the individualized type accommodation. So what we have put in place is all the sanitary measures, hand sanitizers. We also have additional sinks in place, and things like that, so that the children can wash their hands as much as possible. And that is the reason why we have to be very careful in the institution, because there's not a lot of space for us to work with. Some of the dorms are really communal, and so we have to be very, very careful with who comes into the institution, so we don't have any visitors. Which is one of the things that will have a huge impact on us, because we rely on people coming into Liberty for financial sustainability, and so that's going to have a huge impact on the institution.
Has an isolation area been identified for you guys?
Yes, we do have in place a quarantine room and an isolation room that is in Building 10. The ministry is in the process of training staff in the use of protective gears.
Belize is currently in phase yellow, and the virus is contained on San Pedro, where the first confirmed case infected her mother. Since then, there has been a nationwide quarantine, and a state of emergency has been placed on Hamburger's Key, prohibiting travel to and from the island. But in the event that the virus spreads to the mainland, Belize District to be exact, Executive Director at Liberty, Agatha Valentine, says that they will have to tweak its prevention strategy.
We had to look at what are the next steps with regards to staff, because if it hits us at Liberty, it would be a staff that would bring it in. The virus doesn't move, people move the virus. So we have done a lot of planning, again, in collaboration with the Ministry of Human Development. We've done a lot of training of staff members. We have looked at, in the worst case scenario, what would have to be is that staff also be contained to the facility. All right. We have staff that are real team players. Some of the staff has committed to remaining on the compound in the worst case if we progress to a stage 2, 3, 4 with the COVID-19.
Coming up after the break, the emergency response team at BERT says it is ready for the COVID-19.